myself and say why I'm doing this interview, and then introduce you.
Okay, I am rolling.
Good morning. My name is Patrice Worsham, and I'm here today as part of the Portland Leadership Class 3. As one of my projects, I have to interview somebody in the community, and one of the people that was selected is Dr. Clore, superintendent of the Gregory-Portland Independent School District, and our subject is in the event of a pandemic. Dr. Clore, good morning.
Good morning, Patrice.
Thank
How are you?
I'm doing all right, and thank you so much for letting us come into your office and do this.
We're happy to do that.
Good, good. Tell me a little bit about my subject, as far as the school district knows it.
We began reading and learning about pandemic flu about 2 years ago. I attended a meeting at Region 2 Service Center over in Corpus Christi, and there were a number of nurses from school districts. I happened to be the only superintendent of schools in that meeting, but I came back with a book that lays out the background on the 1918 flu epidemic, and then uses that information to begin to suggest some responses that we all might be planning for should a pandemic epidemic occur here. And so we have begun that here in this school district.
How involved do you, does the county and the city get with y'all? Like, do y'all set up strategies? What do y'all?
We work closely together in partnership. The county health department works very closely with us, and they also have been providing training in the area. We have been sending school personnel to those training sessions, and then we come back from those meetings, review that information here in the district, and then try to make plans accordingly based on whatever newer information is coming along.
And
Okay, hold on. Okay, I am rolling.
Good morning. My name is Patrice Worsham, and as a member of the Leadership Portland Class 3, I'm here interviewing Dr. Clore about in the event of a pandemic. Dr. Clore is the superintendent of the Gregory-Portland Independent School District. Dr. Clore.
Good morning, Patrice.
Good
We're
morning.
glad that you're here.
And thank you so much for letting us come over.
Well, thank you.
Of course, in the event of a pandemic, very interested in how we prepare and what y'all do, what the school district does in conjunction with the county. Could you tell us a little bit?
Yes. About 2 years ago, the district began its planning process for a pandemic outbreak. At that point in time, I attended a workshop over at Region 2 in Corpus Christi, where all of us who were in that session got the first exposure to that information. In addition, I was able to pick up a book on the 1918 pandemic that occurred, and part of it contains a framework for how to go about preparing should another outbreak occur, currently. And so we've taken that information, the information that we learned at Region 2, and then information that we have picked up at subsequent workshops, and we have begun putting a plan in place to be able to manage a pandemic situation here in the school district should that ever occur.
Okay. All right. Continue.
So, Dr. Clore, when the county, if something like this should happen, and we know in this day and age of travel, 9 o'clock in the morning you're in India, and 2 o'clock the next morning you're in Corpus Christi.
Right.
And so, in the event of something like this happening, and of course the county has to get involved, are they the suppliers of things like masks and whatever things we need to get by to protect ourselves?
First of all, the masks that were used in the 1918 pandemic probably would not be effective. That has been pretty well clarified between then and now. The county is the managing agency, the county health department. They would work closely with each community in the county and the school districts in those communities, and would be working with us to use part of our facilities if they needed them, depending on the seriousness of the outbreak.
And funding for activities like this, does the state in some part give you all monies for something like this?
No one has volunteered any funding for any of this to this point for school districts. The health agencies do have some funding that's being made available to them. We are simply going to have to work through this together as organizations. And just like when hurricanes occur, we'll have to keep a record of what the costs are that are related to managing this issue, and then try to get reimbursement for them after everything is over and back to normal.
Anything that you would like to add to this interview as far as you would be of interest to the public?
We recognized early that we needed to develop some procedures so that the finance arm of our operation could continue to work, whether we were able to be open as a school district or not. And so we've already begun putting in place procedures for us to be able to manage the finance side of the school district remotely. In case we're not able to come to the office and work in the office, we are trying to be prepared so that we have another way to take care of that eventuality.
Very good. Well, thank you so much for letting us visit with you today. And
Thank you, Patrice.
Look forward to seeing you around town and other social activities.
And other community
Exactly.
activities. Thank you.
Thank you.
All right.
Should I?
Let me give it a second to kick in. All right.
Well, thank you, Dr. Clore, for having us over to your office today and giving us such important information.
Thank you, Patrice. We're always looking forward to the opportunity of working with Leadership Portland, and we hope that this information is useful for your group as well as other people in the community.
I know it is, so thanks once again.
Thank you.
Well, it's natural.
Okay. I went onto the internet and printed, there's so much great information on there. Taking a look at all the newly designed masks and how to wear them, and very interesting material. One site gave me some information on what flu symptoms were like, what cold symptoms were like,
Right.
and talking about things like the Spanish flu in 1918 that killed 40 million people.
That's correct. It's incredible.
Yes, pretty scary. And so telling you how to take some steps, how to recognize symptoms and know when symptoms are a little bit more than a cold or the
Right.
flu.
Right.
So you can get some really, really great information online.
I've been watching a number of C-SPAN programs from the Pacific Northwest. That seems to be the part of the country that is taking the most active and aggressive steps to become prepared. And so that's where we've been picking up a lot of our
Information
is by watching that and watching them.
Yeah. And this particular one talks about the Peloponnesian War and the different plagues and fascinating stuff. Kind of scary too,
Yes, it is.
because it gives you a little idea of the possibilities that we
That's
don't
right.
want. Okay, thank you so
We
much.
still have vulnerabilities.
That's right,
Even in
that's
this
right,
day and
that's
age.
right.
I want you to do the same fiddling with the papers that you were while you were talking,
Okay.
and we can kind of overlay. Show me some of the masks.
The copy isn't so great.
It's okay. We're not going to hear any of this audio. Just kind of flip through the papers. And keep flipping. These are things we can cut away if the camera gets shaky or something. And show me the book. Okay.
This gives you a little visual too of just how
Mhm.
you would have to set up
That's
and,
right.
and what you would have to do and
That's
Yeah.
why we know our gymnasiums would be some
Right,
of the first places
right,
that the county
right,
would
right.
commandeer.
Yeah, yeah. Anyway, this information, goes into HIV, SARS, influenza, everything. Do you have something like this, or would you like to copy some of this?
I'd like to copy some
Okay.
of that. I don't have some of that particular information.
I think this is. Yes,
Okay, thank you.
and I don't know if you want this also. This stuff with all the. This is accompanying online. That is like 11 pages, and you may want, if you want to copy this, fine. If not, don't make
Great.
yourself crazy.
Thank you.
Do you want to do the intro real quick? Because I felt like you might have kind of
Okay, real quick.
flubbed it real quick.
Okay.
Just one. I'm going to put it right on you.
Okay.
Go
Good
ahead.
morning. My name is Patrice Worsham, and I'm part of the Leadership Portland Class 3. Today we're doing one of our projects, which is we selected a subject and we had to interview an individual or individuals for our project. My subject is in the event of a pandemic, and so I have asked to speak with Dr. Clore, Superintendent of Gregory-Portland Independent School Districts, and here is Dr. Clore.
Okay.
Good morning, Patrice.
Best for a job interview. You plan on leaving? No, it's just a
You
Zoom
look great.
councilman.
You look great.
Hey, no, that's not, no. You
You
haven't got my consent.
Y'all both look so
You
good.
haven't told me about how.
And you are
Take one of those.
the fire
Fire
chief. And do I just say the fire chief of the fire department of Portland, Texas, or do I just say the fire? Okay.
Fire chief, city department, whatever. It all means about the same. So whatever works for you, as long as it's not like something other than Portland.
Okay.
Unlike the school district, we don't have anything to do with Gregory. Most people don't realize that.
Oh, you just deal with Portland.
Just the
But
city
if
of
but if Gregory got in trouble.
Oh well, yeah.
Right.
Anybody that calls for help.
Right. Now, Dr. Clore copied some of this stuff that I have, and if you'd like to take a look at it, I got some of it off the internet about all the new masks and stuff like that. Is that of interest to you or not? Okay.
No, we use one type here, and I don't know if you make this part of this. I'll show you before you leave
Okay.
how we would respond to an incident. It's either all the protective gear I have, or you don't need it. I don't have any in betweens. I don't have
Okay.
various stages.
Okay.
I'll show you that before we leave. You probably don't realize we have a hazardous material response unit. We can dress up and do our thing, and I'll show you that before you leave.
Okay. And
Oh,
also.
you've already started?
I'm just rolling.
That's okay. She can
Oh,
edit.
okay,
She can
okay,
edit.
Okay.
I saw a little bit of that this weekend because we had the beach cleanup, and although we instructed everyone not to pick up anything,
I've heard.
that they went ahead and
Right.
with some of the kids, and they were just so proud we didn't have the heart to even chew them out. But they rolled the barrel down the road, and then here came your guys to check it out. So that was very, what's the word I want? Reassuring that.
All but two communities. I shouldn't say that way. There's only two communities in this COG region, which is 14 counties, that have the ability to respond to a hazardous material incident, like Portland or Corpus Christi. Nobody else has capabilities that we have. which is kind of hard to believe.
Yes.
But it takes a
Yes.
significant effort and contribution and determination from COG entities and city leaders to put this kind of response capability together. And I'll show you that for you.
Okay, okay. And just want our public to know that we are chatting with Jim Leahy, our fire chief in Portland, Texas. And that in a little while he's going to take us through the building so we can see some of the equipment they use. And it's I mentioned that I was going to do this to a friend, and they seemed a little surprised and suggested that what was the possibility of that happening. And I thought to myself, in this day and age where you can jump on a plane somewhere and be anywhere in the world in a matter of 24 hours, and if you were ill, you could pass something on.
Mm-hmm.
So it seemed very relative to me.
Yeah, I think you're kind of focusing on if there's an epidemic or a pandemic,
Yes.
which are biological agents.
Right.
Biological agents are readily available in nature. They're easy to manufacture or refine. They're easy to disperse to the public. So they get categorized as a WMD, a weapon of mass destruction, because of their potential to affect so many folks and overwhelm local capabilities. Some specifics with biological agents. As a responder, there's usually not a point source or an incident scene until well into the incident. A biological agent almost works backwards. We use local doctors and hospitals to gather information, which is reported to the county and state health departments. Once they identify some trends, and we look at the demographic of the complainant, are they kids, are they adults, are they elderly, does it span the community, and then what are the signs and symptoms of that? And once there seems to be a air of concern that they're, and not just the regular flu season, but something a little quirky or something a little different, that's when the State Department, Health Department, and county health departments start to look at these statistics, start to interview the doctors. They really want to look for what the initial cause is. Is it a natural occurring? This is flu season. Or is it a biological weapon attack? And that sounds fairly significant, but is there some kind of, is it an attack in a terrorist threat? I can tell you domestic terrorists, people in the town are more of a threat than overseas or terrorists of another country. Usually your domestic folks are your number one. So you think about, is there somebody upset in town that's done something to cause a biological outbreak, if you will, to spread some sort of bacteria or biological agent? So those are things we start to think of. What we try to do, the health department tries to do, is narrow down what's the disease of concern. What are we dealing with? And there's a host of diseases. They're broke down in categories to their incubation time and then their initial signs and symptoms and how fast they react to the human body. And once we try to identify the disease, what's the scope of the exposure? Is this South Texas? Is it one block street? Is it a restaurant? Do we try to get an idea? And with that scope, we listed real specific the signs and symptoms. We have some kind of bleeding, some kind of coughing, some sort of respiratory illness. Any particulars to the signs and symptoms. That initiates some significant investigation. Health department, in conjunction with local folks, it involves law enforcement in case there was a terrorist type incident. Doctors, Center for Disease Control, specific biological, biologist type people who can really identify the disease. We still might not have a point, but we have a developing incident. They investigate the cause. About that time, we start to think about, we need to talk to the public about what's going on. If we have pertinent information, we develop a public awareness, public information, so we can start to tell folks. We recognize there's something going on. If we do have an answer to those questions or do not, well, that's when we start to talk about that. Biological events really affect the public in a pandemonium. Am I going to get sick, as well as the folks who are really sick. So we really have to think about what do we do with the public that's not infected, how do we reassure them, that sort of thing. So that's a two-pronged thing. Part of that then, identifying that disease or biological agent, is Other prophylactic doses or things we can do to the public that's not affected. What are the appropriate treatments? Some sort of antibiotic is usually the first line therapy for biological agents, so that'll come into play. And then how do we protect folks that aren't exposed, that we don't think have a threat? So are there other issues for quarantine, or at least expressing, minimize contact with folks who are sick? That kind of procedure. And then we've identified all these elements. Is there a response to an area or a point source? Has somebody infected the salad bar at the restaurant, like happened up in Washington State? Wow, now we have somewhere to go that we can isolate that facility, analyze what might be there, and really determine what our agent is that's affecting the population. Or has it been an airborne attack? Here comes a crop duster. Probably not likely, but we just had to evaluate what was the source. So that initiates all those activities. Your local hazmat guys, you won't see them dressed up in their suit unless we identify a specific portion being either a portion of town or a building or a point source that we need to analyze, take samples, decontaminate, that sort of thing. Otherwise, it's really like bird flu. Those everybody talks about that, or some sort of an anthrax attack, some sort of biological agent. Most of them get treated initially the same until we can really identify. So here comes the city of Portland and its response. Well, what do? Well, obviously we coordinate specifically and very detailed with the Centers for Domestic Preparedness, Center for Disease Control, the local and state health department, because they're the subject matter experts. So they're going to tell me, we need to isolate this area. We need to set up a prophylactic or a inoculation type dispensing system. We need to segregate this part of the community. And then I take that information, develop a public information plan so we can get the word out. But then what are the task-oriented items specific to that? I have paramedics, so we can give injections. We can administer medications and support the health department. Do we do that on a mass basis or a targeted audience? Those are all things. Really the biological event is a big what if.
Right.
And then you take your organizational structure and plan and build it as you add the what ifs. As compared to a chemical response or a fire or an EMS event, well, we already have that all laid out. We know what the threat is, we know what we need to do, and then we follow protocols appropriately. The biological event is initially a guessing game until we can investigate. And then we almost build that structure backwards to address whatever item comes up. So that's significant. So as a first responder, information on what's going on in the community is of utmost importance so we can determine the threat to our community. Whether it be Corpus has an incident or Ingleside has an incident, obviously we communicate with those agencies. The wind blows, and if this is an airborne type of agent, well, we want to know what our susceptibility is to contamination. So really it's a big communication event until we get down to prophylactic doses and inoculations and giving folks vaccines or whatever might come into effect.
Very good, very good. Thank you very much.
That's probably way more than you wanted to know.
No, we like it. But she's a budding filmmaker.
Uh-oh.
So
did you get my best side?
Look good.
I think this is, let me check. You can take this with you if you want.
Okay.
These are little cheat books that we
Do
use.
you
I
want
call
me
them cheat
to bring
books.
it back? Do I need to return it?
If you do, you do. If you don't,
Okay, I got it.
What most folks don't know in this community is that we have first responders who are hazmat technicians certified at the state level. We have responders who have been to federal level training, weapons of mass destruction, hazardous material training, which means chemical, biological, radiological events and how to take the first steps and to deal with these agents.
Are you hearing him talk as you film this? Oh, cool.
This is a great source of information, not only this book, but this facility in Alabama is the Center for Domestic Preparedness. Fabulous training, doesn't cost us as a city a dime. All we have to do is give the folks off to go. So I have firefighters that have been and attended various classes, for everything from command level classes to initial response classes.
So is this a state-funded program or
It's a federally
federal
funded program.
funded program?
Those kind of programs generate books like this. This is your quick reference. Here is a biological incidents quick reference. Everything from identifying the agent and characteristics of that agent to these are items of concern you should be thinking about if you're dealing with this agent. And a lot of it is how to protect your responders in case they haven't contact with an infected person, or how to protect the community at a whole. So it's really good training. Most cities of 17 or 18,000 with 1 or 2 fire stations do not have the training and the capabilities that we do in Portland. I think we're really fortunate. Not only do I
Very
have,
reassuring.
well, we live here, so I'm really glad that we have those capabilities. And we're a bedroom community, so at night everybody's at home, as
Right.
compared to an industrial community when
Exactly.
most of the folks leave. So we kind of take that a little more serious with this fire department. Is we're protecting folks in their house, and that has a little more severity or a little more importance. Touches home a little more than,
Right,
than
right,
just thinking
right,
about
right,
a
right.
fire in a commercial building. So,
Right.
so that's what kind of motivates
Well, we're
us
glad
here.
you're here.
Well, and we're happy to be here. So why don't we look at some of the
I'll
physical
send you-
capabilities?
Okay, sounds good.
Let's do that.
Yes.
All right, let's move out here. We can get a shot.
Irene, can you edit out things like when I say, is the sound picking this up?
We can edit all of it
Anything?
out.
Okay, cool.
Yeah, you can take that little cheat book.
Okay, good.
And that'll give you some specifics for all kind of stuff, but, and whatever, do you have to do like some kind of written report as well?
No. Well, I
That's
mean,
cool.
I'm going to hand in stuff
Okay.
with the report, but it's not a requirement. It's just something that I want to do. So if you have something that I can hand in with it, that's a printed material.
Think about what you're looking for on the way out. Let's see what we got.
Okay. What time is it? Hi guys.
Hello.
What are y'all doing to the poor person?
Sticking our leaves in them.
Okay. I'm gonna leave this stuff in here. Very cool.
That was 2,000 gallons.
2,000 gallons.
The one next to it's 1,000, the one behind you is 500. You know, we can shoot that EMT deal, and what I can do is, in the event that we need to administer medications, antibiotics, firefighters are able to start IVs, give injections, that sort of thing.
Okay.
And you can film that.
Get
what
some
we're
shots.
actually
Yeah,
doing that.
sounds good. This is even better looking. Yeah, this is great. This is great.
Look at their workout area.
Oh, yeah.
Want to start in there?
Okay. The bad news. Are you good, Irene? Okay.
What do you want me? Oh, y'all just pretend I'm not here, and I will adjust myself.
Okay.
So part of the city of Portland's response capabilities are this trailer. The front part of this trailer is a command area. I have a computer server, reference material, hazardous incident tactical worksheets. Basically, will be the command if we have a point-specific threat or location. Communication equipment. We can talk to every respondent agency in the area, as well as the state, county, all the other cities. And basically, this will be the ground zero of an incident like that. We'll use this as a command structure. The back of the trailer houses hazmat material. If we can sneak through here. This is an example of one of our suits. The suit is an ensemble that has gloves and boots. The firefighter wears the suit, has a capsulated protective area to work in, so he won't become infected. City of Corpus Christi, City of Portland, the only two entities that have this capability. There also are tools, there are analyzing equipment in here, so we can collect samples, we can stop leaks, or we can do almost anything that we can add to that scope of response for a hazardous material. Once we leave the scene, decontamination showers, we decontaminate the firefighter. These bins and smaller actually collect whatever sample. This one will fit a 55-gallon drum. A biological agent probably not in that quantity, so we have evidence collection capabilities, everything down to just little tiny vials. So these are some of the things that we have here in Portland that give us just that added edge. One, it protects the firefighter. Two, it helps us, deal with the threat of the scene. So this is pretty. I don't know if you want to go by there and film any of that.
Cool
But
stuff.
there's more junk back here. There's actually tons of stuff in here. Oil spill response stuff. I have 50 Tyvek, 50 disposable coveralls, an immediate release of some, usually a chemical at that point, but it could be a biological agent. Strip you down, wash you in the shower, put you in that little Tyvek suit, and then put you over in the treatment area. Nobody else can do that around here but Corpus and us. So we can really do some things that folks have no clue that we can do in this little department.
Excellent.
But this is basically our hazardous material response unit, staffed by Portland Fire Department.
So this shower here, this is something you can set up outside.
If we respond to a site, once we make sure that there's a public protective zones, the public safe, we attempt to recon the area. To send anybody into a hazardous environment, I have to have a way of decontaminating them when they come out. What we do then is set up a progression of 3 showers, staffed by a decon team, that when the firefighter returns, we can decon initially his suit, and then remove his suit, put it in a safe area, and then take his information that he's gained from his reconnaissance about what the threat is and what the problems are. So that's how we use that. There's everything in here from water to support the team to portable stretchers in case there's injured folks in the scene or a firefighter collapses, so we can extricate them. Oil absorbent materials in case there's some sort of hazardous material spill other than a biological event. We have machines to analyze chemical substances in a powder or a solid form. So a lot of things in here.
Very good.
We had an open house last year. 2 people showed up. And I think we had some conflict issues, but it was my idea to try to show the community,
Right.
What we can do.
Well,
what we can't.
I think I apologize for the community for not showing up.
Oh, no.
But
It was-
if you do it again, tag me.
Well, we
I'll
do it
help
again,
you.
I'll have some other areas but that'd be great.
Yeah, tag me and I'll help you publicize it and encourage people to come.
Yeah, it was something I'd like to do again. We probably just didn't give it enough time and get the word out.
Yeah.
But we had obviously all the firefighting equipment out, and then I had tables around with the equipment,
Right,
the firefighters,
right.
and then we put a decon corridor together and the suits, and just to show everybody.
Right. Well, I think
this
that's
is something
awesome.
we can do. Yeah, we will. We did it on September 11th, 2 years ago, and I don't. Maybe we do it again this year. I don't know. But it's kind of a neat way to do it. September 11th. Talk about.
Yeah, there's lots of ways to get people out here.
Mhm.
By going to the different clubs in town and
Right,
reminding
right.
them and inviting them. And the Chamber of Commerce has a email thing they do where it goes to
Yeah,
all.
you can shoot everybody out.
And
And
so,
we'll get it in the city newsletter.
right, get it
and
in the
mention
schools.
it at city council
Yes,
meeting.
yes. And so
yeah.
if I can be,
I need to film it. But watch. She's talking about it.
Oh, I can throw it in at some point when y'all are chatting. Break the monotony of the talking heads.
Project over the last, it's been about 4 years in the building. We use Homeland Security grant money to buy all that equipment.
You guys just walk, and
So
I'll.
it gives us the ability to increase our capabilities without impacting money.
Your time in minutes. It's gonna be in minutes. biological, if it's an hour, you gotta do 60
A biological
seconds.
event will require administration of some sort of antibiotic. And what these firefighters are doing are practicing establishing IVs, giving injections, and our simulated patient here is a mannequin that we use to simulate the conditions and then start. We also use those for EMS response on a day-to-day basis. Want to intubate him and breathe? Want to see him there?
Yes,
Why don't you intubate him, Daryl? Okay. How come it's Daryl always finds the camera? He always seems like he's on. Just go through what you would do to intubate him. Okay, just intubation. Again, Corpus and Portland are the only two departments that have firefighters capable of providing this level of pre-hospital care. We have firefighters who are paramedics, intermediate, EMTs, intubate, give medication, start IVs.
Sorry.
CPR is the basic level care. Obviously, we can do CPR. With this kind of capability, we increase your chance of pre-hospital survival by about 4-fold.
You see his chest rise?
Here we go. You stop breathing, problems breathing, and we can augment that problem that you have. Breathe for you. And then secure it. So another thing that we do here.
Very cool, very cool, very cool.
Most folks when the fire truck pulls up, they go, no, I call the ambulance. And these guys go, we can do everything the ambulance can do, we just don't have a stretcher. So,
You know, we were discussing that barrel that was found down at the beach this weekend. When you pick something like that up, what do you do to the barrel? How do you clean the barrel, or what do you do to the barrel? How do you dispose of the barrel?
Yeah, thanks.
Before we would ever pick it up, I try to identify the product that was in the barrel.
Okay.
And what's
It's a
the
little
likelihood
painful.
of that's the handling that barrel.
Okay.
And at what level?
Usually they're
That's the
not
least thing that they
conscious
gotta
when
worry
you're
about.
doing
Yeah,
that.
they're unconscious.
Okay.
There's also have drugs that you can, they're called RSI, rapid sequence intubation.
Oh,
You can
okay.
do the drugs, and
So
what
sort
it
of
basically
washed out.
does is paralyze them.
Washed
And
out.
then you can
Initially, the
Oh.
firefighters respond.
Yeah, that's how I want
it.
There's still a substance there. Obviously, they visually evaluated, looking for substances. We also tested it. I need a liquid on it to see if it contained anything other than
Right.
salt water.
Right.
And once they're convinced there's no threat, then we do two things. Either we just dispose of it in the trash, because that's all it is, or we contact the party that has some sort of tie to the product. In this case, we identified the local chemical distributor whose drum that was. They picked it up the next day. No expense to the city, it's their property. Now, state agencies will look at how did that barrel get in the water to begin with.
Right.
Not our job. We're
Right,
protecting the
right,
community,
right,
protecting our coastline. And so we'll do that.
Okay.
And then to really answer your question, if there's a substance there,
Uh-huh.
to the environment or into the air, hence we put on a suit, those big barrels,
Right,
caps
right,
in.
right.
Now, once we've got something we know is a threat, then we call private companies that deal with mediating.
It's all right.
There's probably some ground contamination associated with that, plus the
Okay.
barrel. They'll come out.
Butterfly him, or what do you want to do? You get it in there?
Are you serious? That would freak you out if you showed it to her. Don't show it to her. Hi, ladies. Glad to be of help.
Well, thank you. Okay. We, I'm with Leadership Portland, and so this is one of our projects, and I selected the subject in the event of a pandemic.
Okay.
And so what we'd like to know is, what is your position with the county?
I'm the medical director of the San Patricio County Health Department.
Okay, and so in the event that something should occur, whether it be chemical or, something spread like the avian flu or whatever, you'd be our first line of defense through the county. Is that correct?
Well, that and we have an emergency director too,
Okay,
which is Ski Sigorski. So we work very closely together. On the medical side, I'm the first line of defense
okay,
for emergency response like hurricane and things like
Right.
that. Then he's the one that helps mobilize the resources, and of course the judge is the ultimate authority.
okay. And so exactly what would happen? Let's just say that all of a sudden somebody started getting sick, and the symptoms were unlike anything we had known before, or more extreme than what we've ever seen. And so they would come to you and go from that to what?
Well, from there, basically, we would notify state and federal resources. The first priority, of course, is to make an identification. And we have available labs and also emergency testing that we can do here to make an initial, and then I have to make an initial decision, and that is what is the response. And there's several, depending on what it is, there's several ways that we can look at that. One is to find out if there's a specific treatment for whatever's going on, and if so, then at least get the folks that are sick treated. Second piece is there a prophylaxis, that is a shot or immunization or pills or something that folks that have not gotten sick yet can use, and in that case, we again have to make a decision on A, is something available? If it's available, is it available and in what quantity? And then activate our distribution network once we've made a determination on who should be immunized or receive the prophylaxis. In the meantime, samples of that get passed all the way up to the feds, and they work on where it came from and how it got there and those kind of things, because it becomes, besides a medical thing, a law enforcement thing also. So we work very closely also with law enforcement on this, and Sheriff Moody in that case. And of course, we have interlocal agreements with all the cities here, so we also end up working very closely with them.
Okay. And I asked this question of one of the other people that I interviewed, and does the state fund y'all in any way, assist y'all in any way in getting this done, or?
Oh yeah, we have grants from both federal and state. I have an emergency planner and response coordinator, and we have emergency plans for both. Well, pretty much it's called an all-hazard plan. Everything from hurricanes to biological to nuclear to chemical, flu pandemic, any pretty much response for anything we can think of that might happen. We even have one for snowstorms here. No, we do. It's got it. You know,
Yeah,
should it ever happen,
exactly,
we're ready to,
exactly.
we're ready to implement. So
Yeah, and well, we had that beautiful snow a while back, so I guess
we did not implement our plan. That was not
No
one that required
problems.
emergency
Yeah,
response,
yeah,
but we do
yeah.
actually have one for that.
Good.
So,
Is there anything else that you would like to add to this that you might want us to know, or?
probably the most important thing is no plan survives first contact with the enemy. That's what we say in the military. It's the same thing here. You can plan all you want, and the whole thing goes out the tube just as soon as something happens. And so one of the most important things is to have good, well-trained people who have agility to improvise and understand conditions as they are. And the other thing is there's no substitute for being there. One of the things that happened with some of the leadership in Katrina is they basically went to the top of an office building and stayed there and never went out to see what was going on. Therefore, adequate response wasn't done. So when this happens, usually I will be at the site whatever's happening is happening, and then I have my administrators and other people who are actually doing the coordination in the Emergency Operations Center. But that's the key to it, is to be there.
And so obviously you work very closely with the fire department and all the stuff that they have there for hazard.
Yeah,
hazardous.
Donna McMahon, my nurse practitioner, and I both are trained in bioterrorism, biohazards, and have the yellow suits and the respirators, actually right around the corner there, and that we have available to us, and so that we can actually go on site for what we call all hazard.
Right.
They're the level 4 suits, the ones you see in the movies, except they don't have lights inside, because nobody can see what they're doing when there's a light inside.
Yes.
That's a purely movie thing, and
Okay.
they are a pain to work with.
Are they?
Oh, they're
difficult?
horrific, yes.
Yes.
They're hot and sweaty, and your oxygen lasts about, for me, it'll last her about 19 minutes, and for me about 16 minutes, because I have bigger lungs than a girl.
Right.
And then you got to get out, change, and put on new oxygen and go back in. So you're very limited in what you can do there.
So the oxygen element to the suit is
It's fully self-contained. It's the same that the firemen use, SCBA, self-contained breathing apparatus. And in fact, it's interchangeable, obviously, with our fire departments so that we can work with them.
excellent.
So yeah, all our equipment's interchangeable there.
Sounds like all the ducks are in a row, and we really.
No way, no way. We've done a lot of planning, and again, you're never done. One of the things in the military, they have, and it's the same thing here, we have what we call a deliberate planning cycle and a crisis planning cycle. The deliberate planning cycle is continuous. Every year, at this time of year, we're doing it right now, we pull out what we call Annex H, which is the health and welfare part of the San Patricio County Emergency Plan. And every year, we revise it as need be at the beginning of hurricane season. In addition, we do the shelter plan. We have a new plan now for animals, and we're still trying to get that in order of what will happen, A, if people abandon their animals, or if they want to take them with them, and other plans like that. So we're continuously updating these. Crisis planning cycle is, as I say, no plan survives first contact
Right,
with the
right.
enemy. So then when something happens, you take all that, you use the basics that you got, and you create a whole new plan. So it's never in a row, you never can do
It's
enough.
a living
But
thing.
we're doing what we can, and more than most people know, actually. It's kind of
Yeah,
weird. Most people
yeah.
aren't really aware of what all we've done, or haven't seen Donna and I wandering up and down the stairs. We go over to the stadium in our yellow suits.
Right. Oh, really? Doing
Yeah,
over there.
well, we figured if we can climb bleachers and that, we can pretty much do anything. So that's how we do it, is
That's
climbing
great.
bleachers in our
That's great.
suits.
Well, I
Actually,
wanna,
the Caller Times, if you go Google it or something like that, they did an article on us one time back.
is that right?
About, when was that they did that article, Donna? 2 years ago?
Hanging right here.
Oh, well, we can make a copy.
Oh,
if you
yes,
want.
we'd love,
Do
well,
you
we
really?
can, she'll shoot it.
Wow.
Yeah,
Okay,
yeah.
we'll go shoot
Well, I
the
really
thing
want to
then.
thank you for your service to the community, to our
Happy to.
county. We really appreciate it, and it's very reassuring to know that you're out there.
Yeah, we,
05, August 15th.
it's not been that long. Golly.
So the Caller Times took a shot of y'all.
They were over here for something else and kind of learned about that and went, we'll come back and do that.
So Donna, are you the one in the suit?
Yes, ma'am.
And so was it really hard to climb up there?
Not really. I didn't think it was too hard.
It's just hot.
It was very hot, and
hot.
just, getting your breathing down with the Scott pack we had on our back was the
It says you're about 40 pounds.
Yeah.
And that's before
Oh,
you
wow.
carry any equipment or anything.
And so he just said something interesting to us that, you have so many minutes of oxygen, and so you have to get out of the suit and get into a new suit, or that oxygen can be renewed in there, or
Well, it depends. Basically, they got to completely, go ahead. They got to completely decontaminate you. The assumption
before
is
that you get in the other suit.
before you can go change, the assumption is you're contaminated with whatever's there. So you got to go through a whole decontamination process, at least to get out of the suit enough for them to change the bottle. And then you back on,
Back
and
on
out.
there and go
But
back
you
out.
got to be, but otherwise, if you just walk out somewhere and pull that off, you just contaminated everything. So
Oh,
it's not an
okay.
easy process.
Okay.
We'll make you a copy of that if you want.
Okay, please.
I think that'd be good.
Yeah, that'd
Sure.
be great. And thank you
Happy
again
to.
so much for letting us interrupt your day.
No problem.
We really
You-
appreciate it.
Pass the word out that because people, it's kind of interesting, same thing with Homeland Defense. People, because they don't hear anything, you think nothing's being done.
Right.
And very not true in both cases.
Yes, I'm
Can't
learning
talk a
that
lot
today.
about it, but
Yes,
trust me,
yes, it's taking place.
There's a lot of things
That's
that are happening
excellent.
that
That's
just aren't
excellent.
public
That's
knowledge.
excellent.
Well, this is public. We can talk
Yeah.
about this all you
Well,
want.
thank you.
Thank you.
Thank you so much.
Appreciate it.
Uh-huh.
Thanks for coming.
Thank you.
Come on up front.